Johnson. Glad that you joined our call today. We're dialing almost 60,000 households today, so please be patient with us. We're going to wait another minute or so before we actually start the conference, but you'll be able to ask questions and participate. So please don't hang up. We'll be right with you. Thanks a lot. Good afternoon, folks. I'm Bill Johnson, and I'm honored to be your representative here in Congress. I want you to know that I am working to make our federal government in Washington more effective, more efficient, and more importantly, more accountable to you, the American people, because I know, and you know, that it's not Washington that should decide the path that we take and the decisions that we make, but it's you, the American people. And ultimately, you should be in charge of your health care decisions, not the federal government. Before I go any further, I would like to tell you how you participate today. If you'd like to ask a question, press 0, and it'll put you in the question queue. You'll be able to ask your question, and then it'll put you right back into the call. I want to thank you for joining me on this telephone town hall today. It's a privilege for me to be able to speak with you about issues that mean the most to you. I think probably quite a few of you already know a little bit about my background, but for those who don't, please let me introduce myself to you. I was born and raised on the farm. We farmed with mules, in fact, up until I was about 13 years old. After high school, I joined the Air Force and spent nearly 27 years on active duty. Retired in 1999 and went into the private sector as a businessman before being sworn into Congress. I'm a husband, I'm a father of 4, and a grandfather of 5. And like many of you, I'm concerned about the future that my children and grandchildren will face. And that's primarily why I ran for Congress. Let me remind you, if you'd like to ask a question, please press 0 on your keypad. That'll let you ask your question, and then it'll put you right back into the call. You know, America's at a crossroads when it comes to strengthening and protecting vital programs like Social Security and Medicare. According to a recent report by the Medicare trustees, if we do not act now to protect and save Medicare, this vital program will be bankrupt by 2024. President Obama's plan for Medicare is in fact bankruptcy. In fact, President Obama cut $500 billion from Medicare when he forced his new health care law on the American people. This is why I have supported and voted for real solutions that guarantee that no seniors and those 55 years of age and older will see that no change occurs to their fully funded Medicare coverage. That's very important to me. I've got an 80-year-old mother who is also dependent upon her Medicare, and I can tell you, I'm not going to stand by and watch my mother or any of you or any of our other seniors have their Medicare coverage toyed with at this point by the federal government. Again, if you'd like to ask a question, please press *0. I'm sorry, just press 0 on your keypad. Not *0, just 0 on your keypad, and it'll put you into the question queue so that you can ask your question. You know, I have voted also for solutions that are going to strengthen and preserve Medicare for future generations. And I believe, and similarly, that Social Security is a vital program that seniors rely on, and we must protect it because they invested in it. It's not like they can roll back the clock and make other decisions about providing for their retirement years, they weren't asked by the federal government whether or not they would participate in Social Security. They were required to, and now that is a promise that the federal government needs to honor and stand up to. That's why I co-sponsored the Social Security Preservation Act, designed to keep Washington bureaucrats from raiding the Social Security Trust Fund in order to pay for their pet projects. And I hope that we'll get into some of these kinds of discussions today, and we'll get into some details. Again, if you want to ask a question, press 0 on your keypad, and then we'll get you into the question queue. I'm Congressman Bill Johnson, and it's great to be with you today. We're going to talk about things that are important to you. You know, we're learning every day just how disastrous President Obama's takeover to America's health care really is. And just this afternoon, I'll be voting to repeal yet another key part of this bill that imposes a tax on medical devices. This tax raises costs for you and will ultimately ration your health care, which is why I am voting to stop the tax. This is another example of why the law needs to be repealed in order to protect your access to quality, cost-affordable health care. Now, these are just some of the issues that I think are important to you, but you may have others that you want to talk about, and we'll talk about them too. So if you've got a question, press 0 on your keypad. It'll let you come in and ask your question, and then you'll be placed right back into the call. Before we go to our first caller for questions, let me ask you a question. If this is the first time that you have ever participated in one of these conference calls, press 1 for yes, press 2 for no. If this is the first time that you've ever participated in one of these conference calls, press 1 for yes, press 2 for no. And with that, let's go to our first question.